Hello everyone, my name is Ali and today I'll be speaking to you about cannabis and why it's legalised for medication usage. Medical cannabis is part of the herb plant, which is used for physical conditions such as blah blah blah. It's a recommended form of medicine, or as others can say, herbal therapy. The cannabis plant has a long history of medication usage. Cannabis is also known as hemp or marijuana. Drug classifications. Illegal drugs are put into three different classes: A, B, and C. Class A drugs are considered to be the most harmful and attract the most serious punishments and fines. These include heroin, cocaine, ecstasy, and LSD. Class B, if you are found holding these, you can go to jail for 14 years. These consist of amphetamines, speed, and cannabis, or as others say, marijuana. Class C is illegal to have, give away, or deal with these. These consist of tranquilizers, which can be used for animals with specific reason, Valium, and any anabolic steroids. Conditions for medical usage. Why some people use it for medical aids, because apparently cannabis can reduce the nausea, loss of appetite, vomiting from the condition itself, and medication as well. Cancer. Many side effects of the medication to stop cancer can be relieved with cannabis. Some studies suggest that cannabis tends to slow down the progress of some types of cancers. Chronic pain. It can help to alleviate the pain caused from many types of injuries and disorders. Epilepsy. In some patients, epileptic seizures can be prevented with cannabis use. Anxiety, depression, or obsession. Even though it's a mild anxiety is a common side effect in some users, cannabis can elevate your mood and expand the mind. In some countries, they believe it's illegal to have. In Australia, it is politicians within the Australian Capital Territory voted to allow doctors to determine when marijuana is medically appropriate. In Adelaide, since October 2011, it has been legalised for medication usage with prescription. In South Australia, possession of cannabis is a moderate offence, with fines ranging from $150 to $300. In New South Wales and Tasmania, cannabis is illegal and can attract fines and prison sentences. In Queensland, it's a criminal offence to have any type of cannabis and can be convicted for it. In Ireland, under the Irish law, cannabis is not recognised as having any medical benefits. In New Zealand, there's a fine up to $500 and a 3-month prison sentence. Positive and negative effects of these are positives. Having the munchies, feeling happy, relaxed, forgetting worries, increased imagination, creativity, and feeling of excitement. Negatives. Again, having the munchies can be a positive and negative. Becoming forgetful, neglecting work and duties, oversleeping, problems with performing skills, and not completing tasks. Cannabis, marijuana or hemp, is a controversial issue with a lot of information being spread around, both for and against it. Positive effects, as I just listed before, again listed now, were fairly typical for what one may have heard about the drug. Some of which being feeling relaxed, feeling happy, having the munchies, again also a negative, increased enjoyment of music and art, more appreciation of the surroundings, forgetting cares and worries, better imagination and visualization, increased activity as well as enjoyment of sexual activity, and increased feeling of excitement. The negative effect findings were also pretty typical for what one may have heard would include being forgetful, oversleeping, not having things done, concentration difficulties, neglecting work or duties, loss of balance or dizziness, problems with performing tasks, and nausea. From these particular findings, several facts have been concluded. The main conclusion seems to be that if used casually, cannabis positive effects outweigh the negative. The source states that cannabis users generally enjoyed it and found it beneficial to them. But they did have some disturbances of cognitive function and mood, which did later on include disorientation, depression, and anxiety, including paranoia. They found that in casual users, the effects, either positive or negative, only lasted during the time of intoxication and sometimes the following day, and that as long as use remained casual rather than heavy, the effects would not become problematic. There have been studies of health risks with the use of cannabis. Scientists said that it was discovered that the risks of smoking cannabis were different and perhaps even less compared to those smoking tobacco. It was found that due to the large amount of individuals smoking cannabis combined with tobacco, statistics describing cannabis dependency might have been inflated. The fact that it was the nicotine in the tobacco that people were becoming dependent on rather than the cannabis itself. I've come to the conclusion that the worst risk of cannabis is when it is mixed with tobacco, as that is the addictive ingredient. Cannabis on its own does not have the same health risks associated with recreational cannabis, as it is not mixed with addictive or dangerous ingredients. And if used for medical usage, it has shown to release pain associated with arthritis and various other diseases. Now here's some interviews.